It is so tough watching someone you love deal with the day-to-day challenges of getting older. The aches and pains, the sleepless nights, all the worries. You just want to find something, anything that can help them feel a little more comfortable, right? To help them enjoy their life again. So today, we're going to dive into whether a natural option like CBD could actually be part of that solution. So where do we even begin with all this? Well, we start with the one question that probably brought you here in the first place. It seems like a pretty simple question, doesn't it? But the answer isn't quite so simple. As more and more families start looking into CBD to help manage all those common symptoms of aging, it's absolutely crucial that we understand what that really means. So let's break it all down. Okay, so to figure out if CBD can help, we first have to get real about the specific challenges that our seniors, especially those in their 80s and beyond, are up against every single day. Yeah, just looking at this list, I'm sure a lot of this sounds familiar. We're talking about that chronic arthritis pain that just won't quit, restless nights, that constant feeling of anxiety, nerve pain, stiffness, even just getting their appetite back. These are the exact areas where people are now seriously looking at CBD as a potential source of relief. And listen, while all of these are a really big deal, there is one issue that stands head and shoulders above the rest. The number one reason, by far, that families start looking into CBD is for pain. It is often the most relentless and just draining symptom of getting older. Now, this chart is a fantastic way to think about it because here's a key insight. Not all pain is the same, so you don't treat it the same. For that localized arthritis in the hands or knees, a topical cream can go right on the spot. But for that widespread, all-day kind of ache, a tincture that works through the whole system might be better. And for that sharp, targeted nerve pain, a stronger topical might be the answer. It's really all about matching the right tool to the right job. So you might be asking, why go down this road instead of more traditional options? Well, a huge part of the appeal is that CBD is natural and it's non-addictive. That's a huge contrast to something like opioids. It's usually really well tolerated, and as you see here, it has a key benefit. It can help with inflammation systemically, throughout the whole body, which gets to the root cause of a lot of these age-related pains. Okay, so let's say you've decided to explore CBD. You start looking, and suddenly you're hit with this wall of options, right? Tinctures, gummies, creams, it can feel totally overwhelming. So let's make sense of the most important choices you're going to have to make. First up is a word you are going to see everywhere: spectrum. This is probably one of the biggest points of confusion for anybody new to this, but honestly, it's pretty simple once you break it down. Okay, so here's the deal. Full spectrum has all the good stuff from the plant, including a tiny, tiny non-intoxicating amount of THC. The idea is that all those components work together. It's called the entourage effect, and it can be more effective, especially for pain. Broad spectrum, on the other hand, is basically the same thing, but with all of the THC completely removed. This makes it the perfect choice for anyone who wants to avoid THC entirely. All right, next up is something that's just as important. How easy is it to actually use? For an elderly person, how they take CBD is a huge deal. Tinctures are just simple drops under the tongue. Gummies are even easier. They're pre-measured, so there's no guesswork. Topicals are great for anyone who can apply a cream. And this water-soluble kind is fantastic because you can mix it right into their morning coffee or tea. It just becomes part of their routine. Okay, everyone, I need you to really, really pay close attention to this next section. We've talked about the good stuff, the potential benefits, but absolutely none of that matters if this isn't done safely. These are the non-negotiable rules. This is, without a doubt, the single most important warning. CBD is processed by the liver, and because of that, it can interfere with how the body processes other medications. And I want to be clear, this isn't a minor thing. It is a critical safety issue. So specifically, you have to be really aware of potential interactions with common medications for seniors. We're talking about blood thinners, heart medications, and diabetes drugs. And here's a fantastic rule of thumb. If a medication has a grapefruit warning on the label, you can be almost certain it will interact with CBD. And that leads us to the one rule that you absolutely cannot break. And I really can't stress this enough. You must talk to their doctor before starting CBD. And don't just ask about it. Bring the actual product you're thinking about using to the appointment. Talk about the ingredients, the dose. This is the only way to make sure you're being safe. So once you have the doctor's green light, the mantra is simple. Start low, go slow. A senior's metabolism is just different, and their body can be way more sensitive. So, like you see here, This means starting with the smallest dose you possibly can, giving it at least 2 full weeks to see how they feel, and only then thinking about a tiny increase. Patience is everything here.
All right, I know that was a ton of information, so let's try to put it all together into a plan that makes sense. What does this look like in the real world? Here's a super common scenario, one that I'm sure a lot of you are nodding your heads to right now. An 82-year-old mom, she's got arthritis in her knees and hands, she has a really hard time sleeping through the night, and she's already on heart medication. Sound familiar? So what's the game plan? Well, step one, and you know what I'm going to say, is non-negotiable. Talk to her doctor and be specific about that heart medication. Once you get the all clear, step two could be to think in terms of a system. Maybe a daily tincture for that all-over relief, a cream to put directly on her joints, and a gummy designed for sleep. And finally, step three is to follow that start low, go slow rule. Give it at least 2 weeks before even thinking about making a change.
So, as we wrap things up here, the main takeaway is this: CBD is not a miracle cure. It's a tool. It's a potentially powerful tool for managing symptoms and improving quality of life, but it's one that has to be used responsibly, with knowledge, and most importantly, with a doctor's guidance. At the end of the day, the goal is just to help our loved ones feel better. And the best, safest, and smartest first step on that journey isn't to a CBD store. It's to a doctor's office to start a conversation. So, is that a conversation you're ready to have?